Good morning, sir.
Morning.
How are you doing?
I am in pain.
You're in pain. Oh, I'm really sorry to hear that. Well, my name is Silibaziso Mupereki. I'm a student nurse at the University of the Western Cape, and this is my supervisor. She's going to be watching me as I'm going to be doing my procedure. Is that okay with you?
Yes.
That's fine. Okay, so we are both nurses, so everything that we discuss with you need to be very confidential, okay? Okay, so before I start, I would just like to make sure that you're the right patient. So I'm going to identify you. So using my prescription chart, I'm going to take my patient's ID band. This is Silibaziso Mupereki, that is correct. Born on the 3rd of March 1977, that is correct. Folder number 123456789. Perfect, you are the correct patient. So, Mr. Mupereki, what I'm going to be doing today is I'm going to be giving you your medication. And the reason why I'm giving you medication is because the doctor has prescribed it. And also, it's to help your condition so that it gets better, because that's why we drink medication. Is that okay with you? Okay. Is it okay if I speak in English?
Yeah.
Can you hear me?
Yes.
Can you understand me?
Yes.
Okay, that is perfect. Thank you so much. Can you just excuse me for a few minutes? I just want to look at your file so I can learn more about you. Is this okay?
Yeah.
Okay. And then before I leave, do you need anything? Do you need water? Okay, I'll bring you water just now. Do you need to go to the bathroom? No. Okay, perfect. I'll bring you your water just now. Okay, I'm just going to make sure that my patient is in a safe environment. I have closed the curtains for privacy. The floor is dry so that my patient is not hurt and I will not be hurt in the process. The bed breaks are on so that my patient will be safe. I've given my patient their bed bell so they can call a nurse should they need anything, and their bed locker is by them so they have their things if they need access to it. We're now going to look at our patient's file. Okay, when we look into our patient's file, we need to check off the following information. First of all, we need to make sure that our patient's sticker is here, or the information is written down and it correlates with our prescription chart and the ID band, to making sure that we're getting the right information from the right patient. And then you need to check for the patient's main complaint when they were admitted to the hospital, their diagnosis, any allergies if they have, previous illnesses and operations, whether they were hospitalized or not, any risk factors such as smoking, drinking, hypertension, and diabetes. Then we need to look at the patient's vital signs and interpret them. And with this information, we find it on our vital sign chart or a temperature chart, depending what you call it in the hospital. And then we need to look at our prescription chart. When we're looking at our prescription chart, we need to make sure that this prescription chart is valid. And there's a few things we need to check. One, we need to make sure that the patient's sticker or information is written down. We need to make sure that their diagnosis has been written down. We need to note any allergies should the patient have any. We need to note the ward that they're in, and then we come to the medication that we're going to be giving our patient. When we're giving our patient, we need to make sure that the medication name is written down, the dosage, the route, the time that it was prescribed by the doctor, because it will affect the time that we administer the medication. And then we need to check the frequency, how often we give the patient, and we need to make sure that the doctor's name, signature, and practice number is there. And this will make sure that our prescription chart is valid. So with this patient, we can see that they've been prescribed paracetamol 1 gram per OS or orally for 6 hourly, and the doctor signed. And then here's the times that we need to check. If it's 6 hourly, that means there's 6 hours between each time. We need to make sure that we're giving our patient the medication at the correct times. So right now it is the morning. That means the patient is going to be receiving the medication for 10 o'clock. This is the medication that we're giving for. Looking at this prescription chart counts as our first check. Now we know that the patient needs paracetamol 1 gram. Mr. Mupereki, thank you so much for being patient with me. I am back. So here's your water. I'm going to give you your water just now. But from the prescription chart, the doctor has prescribed you paracetamol, which is a pain medication, which is what I'm going to be giving you right now. Is that okay with you? Okay, perfect. I'm just going to prepare the medication for you. Please note that this part of the process happens at your medication trolley, however the medication trolley looks in your hospital, you need to make sure that you have the patient's prescription chart with you by the medication trolley so that you can locate the correct medication. So while I'm at my medication trolley, I'm going to look at the different medications that's there, and I'm going to find the one that's prescribed, which is paracetamol, which is this one, paracetamol 500 milligrams, and this counts as our second check. So looking at the medication that we took from the medication trolley, we can see that the paracetamol in the medication trolley is 500 milligrams, but the medication that has been prescribed is 1 gram. Therefore, we need to do our drug calculation to calculate how much medication the patient has to receive at this moment. So when we're calculating our medication, there's a formula that we use. So we know that the dosage required, which is the dosage that has been prescribed by the doctor, is 1 gram, which is also equal to 1,000 milligram. And then dosage in stock, or the dosage that is in our medication trolley, is 500 milligrams. So the formula goes like this: dosage required over dosage in stock times volume over 1. For any medication that is a pill or a solid, the volume will always be 1, but the volume changes if the medication is a syrup. So dosage required is 1,000 milligrams, and dosage in stock is 500 milligrams times 1 over 1. Now we're going to do our division. 1,000 milligrams over 500 milligrams times 1 over 1. You might think that it's very repetitive doing this again, but when you're getting marked, they want to see all the steps that you made. So we cross out our signs and we divide both sides by 500. So that's 2 at the top and 1 at the bottom, times by 1 over 1, and at the end it's 2 times 1 is 2, 1 times 1 is 1. Anything over 1 stays the same, so that means our patient is getting 2 tablets of paracetamol. Perfect. When we've calculated that our patient needs to get 2 tablets of paracetamol, so we're going to prepare the medication for our patient. We don't want to cross-contaminate our packet. Patient is getting 2 tablets. Okay, and then before you give the medication to your patient, you need to do the third check. This is paracetamol 500 milligrams. This is also paracetamol, but it's 1 gram, and we calculated that it's 2 tablets. Okay, so Mr. Mupereki, I've brought you your medication. Here are your pills as prescribed by the doctor. Use your water. While the patient is drinking the medication, you need to make sure that the patient swallows. So after they've taken the pills, you need to ask them to open their mouth, open the roofs of their tongue, and put it up and down so you can check if they've swallowed their medication. And then while you're speaking to your patient, please check if there's any possible reactions that the patient might be having. So Mr. Mupereki, I've given you your medication, that was paracetamol. It will just help to relieve the pain of your condition or infection that you have, and it will also help with decreasing your temperature because you had fever when we looked at your vital signs. Please do let me know if you get any reactions, like you get itching, you start feeling feverish, or your temperature rises, or anything that is out of the ordinary. Will you please let me know? Okay, thank you so much. So at this moment, teacher, I just want to give you some health education on how to improve your condition. At this moment in time, you need to look at what your patient's diagnosis is and give appropriate health education. It can form part of exercise, diet, follow-up checks, taking the medication, etc., etc. Whatever you see is appropriate for the condition that your patient has. And please make sure that you're reminding them constantly to look out for any severe reactions that they might have. Even though they might not have allergic reactions to that type of medication, something might happen and you need to be, and your patient needs to be aware of this so that they can tell the nurses appropriately and as quick as possible. Thank you so much, Mr. Mupereki, for being patient with me, and I hope you will get better as soon as possible so you can go home with your family, because I know you miss them. Okay, so here's your bed locker, and here's the bowl should you need anything. And should you need anything, just shout and one of the nurses will help you. Is that okay? Okay, thank you so much. I'm just gonna make you comfortable. So at this moment in time, you need to make sure that your patient is left in a comfortable position and they are calm, and then you need to record whatever you've done with your patient. So when you're recording, you need to make sure that you mention that medication that you gave, the quantity, which is the milligram, and also how many tablets that you gave your patient. You need to make sure that you mention that the doctor prescribed the medication and that the prescription chart was valid, and how you left the patient, and also the health education that you gave them. Make sure that you sign, you put your school's name and your student number in the year level that you're in, just to make sure that the nursing notes are valid. Thank you so much for watching this video. I hope it will help you out in your journey as a nurse and to be able to give your patients proper health care while you're giving them oral medication. Thank you. Bye.